my routine monitoring of government facilities and the service delivery centers, I went to Bufumbo Health Center IV, now back to Abwamwangu Primary School, and now at Bukonde SS. What I've discovered is that at least in Bufumbo Health Center IV, services are going on well, and I was privileged to even find to witness the delivery of drugs in Bufumbo Health Center. So I appeal to my people in Mbale city to go to government facilities. Drugs have been delivered. However, at Womango Primary School, I found the head teacher had received the funds, but when I tried to ask for an accountability to look at it, just to ascertain whether the purchases carried out had receipts, there were no receipts. So that one is giving me some second thought that maybe when these funds come, some people spend it in areas which are not supposed to. At Bukonde SS, yes, there is well, last time they got 77 million shillings, but I'm surprised to find out that out of 77, 13 has been spent on allowances for board members and PTA members. That is too much money at a school of this nature of 1,132 students to get just a committee of PTA and board members spending 13 million out of 77 is too much money. I'm going to appeal to them to ensure that they revise at least their rates, because to scoop 110,000 shillings several times at a smaller school like this one drains the economy or the income of the school.
I'm Kusasira Joyce, the Senior Nursing Officer of Bufumbo Health Center IV. I just want to confirm that we have received the drugs. They arrived today, this morning, and our stores person has received them. They are in the store, so we plan to arrange them tomorrow in the shelves. The situation before we received the drugs it wasn't really so good. We had a shortage of drugs, but doctor somewhere, somehow, could pick on funds and try to purchase drugs, and we will at least try to punch up the gap so much as we wait to receive from NMS. We receive so many patients. They can even go to about 200, 300. And the major cases we receive at the moment, there is an outbreak of malaria. Most patients, the highest percentage, are malaria cases. So we need mostly to stock the antimalarials. And the drugs, surely, that doctor tried to buy, to purchase from GMS, to try to bridge the gap with the antimalarials, because we needed them so much. Because our patients were really suffering. We can't send them out without antimalarial. When they have malaria and we have no antimalarials. So at least he had to solicit some funds and he had to purchase those drugs. Attestate and major attestate. And when we move around to other facilities, if we find those that have enough stock or more than enough, we pick some and bring redistribution system.
Better next.
Malaria outbreak, I will not say that's the real major cause why you have a malaria pandemic now. I would attribute it to the rainy season we are having. And because people have dug, crops are growing, mosquitoes are bleeding a lot. It could be one of the reasons why we are having an outbreak of malaria. Yeah, to the people outside there, we have received drugs. Even before I say it, they have already seen the car and they are already aware the drugs have come. And automatically, believe me, tomorrow and tomorrow next, the place will be full of patients.
Your name is once again?
On my routine monitoring, after getting an alert that NMS is delivering drugs, I came direct to the Health Center IV of Bufumbo, and really I found they have delivered drugs. And what impressed me is that even if it is lunch hours, even when the incharge is not there, the one standing in for him is around, and phone patients have been attended to, because you don't find any crowded patients here even when they were there early morning. So this is a very good impression that our health workers at least are pulling up the attention to clients, so that people can get satisfied with the services government deliver in health. I found some of the ladies out there, asking them why are they here, but I was meant to understand that they have an appointment with the doctor who is coming after lunch to attend to them. So my appeal to all the people of Mbale City is that please go to our health centers. We have drugs there. People say government doesn't deliver drugs, but what are these? These are delivery notes for all this stock you are seeing here. So anyone saying that government facilities do not have drugs, either he must have not gone there, or he's just malicious. But of course I can't say government delivers drugs which can cut across all times. No, they can be consumed and get finished, but at least in the cycle of every 2 months, drugs are brought in. Like today, we are closing the cycle, all the 6th cycle in the year 2021-2022 financial year, and we are now preparing for the next cycle in 22-23. So government commitment is there, and drugs are there. Although these malicious people have a problem that they may be also having their private business in medical sector there, to want to divert patients from coming to government facilities so that they can get customers there. But we shall also continue giving people information that drugs are there, go there. Where they are not, the health workers will guide them on an appropriate action to take.